Subclinical mastitis in cattle. So for the clinical classification, there's clinical mastitis and subclinical mastitis. Subclinical mastitis makes up 80% of cases. And for the pathological classification, there's galactophoritis, parenchymal, and interstitial. Galactophoritis is the gland and teat, parenchymal is the minor cistern and the ducts, and the interstitial is between the lobules. So for the occurrence, it makes up 80% of cases. And for the diagnosis of subclinical mastitis, it increases the stomatic cell count. The normal is less than 200,000 stomatic cell count per milliliter, and the maximum is 400,000 stomatic cell count per milliliter. They are mostly leukocytes. Also, during subclinical mastitis, there is an increase of the electrical conductivity. This is because there's a change in the sodium and potassium in the milk. There is also a decrease in lactose and an increase of LDH and an increase of APP. Automatic milking systems are able to predict clinical mastitis. And then there's also the California mastitis test. It's semi-quantitative. If there's a negative fluid, it's less than 250,000 stomatic cell counts. If there is a trace, you'll see minor flakes around 300,000 stomatic cell count. If there's major flakes, you'll see 900 stomatic cell count. And if it's thick but no gel-like, it's around 3 million. And if it's jelly-like substance, where it goes completely purple, it's 5 million stomatic cell count. So if you have orange fluid, it's okay. But then if you have purple jelly with thick jelly substances, it means there's a lot of bacteria. For treatment, during lactation, it's not advised, especially on large-scale herds, except if the bulk tank stomatic cell count is too high. However, in a dry cow, do an intramammary infusion on an individual level. There's no blanket therapy. You have to do it after microbiology and an antibiotic resistance test.